Hi, I'm Dr. Cohen. Are all Lasik the same? And if not, how do you judge the value of what you're getting? You see, there are many ways to cut corners and make Lasik cheaper. In this video, I'll explain what kind of things you need to look for in order to, one, minimize your risks, and two, get the sharpest possible vision. The first factor for success, not surprisingly, is the surgeon. First, you need a cornea specialist. Lasik is a procedure that's performed on the cornea. A cornea specialist is an eye surgeon who had further subspecialty training in the cornea and is the most suitable person to perform Lasik. Although many general ophthalmologists perform Lasik, you are more likely to get a better and safer result with a fellowship-trained cornea specialist. Over the last 20 years, I performed over 75,000 laser eye procedures, including on more than 1,000 doctors. Over that time period, I devised a unique system for reducing errors and complications. After I make the plans, another doctor I work with independently double checks all the measurements and the treatment plan before the surgery. And I myself check it one more time just before the surgery. The second factor for surgical success is the equipment. Cutting corners to decrease costs increases the risks and produces inferior outcomes. One of the main strategies many Lasik centers use is cheaper lasers. The laser used for the treatment is essential for getting the best possible vision. We use the Allegredo 500 laser for the treatment. This is the only FDA-approved laser for doing topography-guided Lasik, also known as Contura. Clinical studies show that this laser can achieve results that are superior to 20/20. Contura starts with a precise map of your eye's surface and captures unique irregularities, the type that glasses and contacts cannot correct. The laser machine tailors the treatment to your unique eye contour. The result is a personalized vision correction targeting even those elusive distortions. And clinical studies show that 65% of the eyes treated with this method are better than 2016, and some even achieved 2012. In order to increase the safety of the procedure, we use two different lasers, one to form the flap and the other one for the treatment. Instead of cutting corners, all our efforts are focused on providing you with the best possible visual outcome in the safest manner. I wanted to share the story of why I became an eye surgeon. It can be traced back to a tragic accident involving my brother. He had an injury when he opened a refrigerator door. A Coca-Cola bottle fell and exploded, and a glass shard entered his eye. He had surgery to fix this problem, but there was a surgical complication that led to a number of other surgeries. I remember the surgeon talking to my parents and explaining that every surgery has risks. And I asked myself, what if there were ways to prevent those risks? My brother's tragedy pushed me to seek and obsessively fine-tune methods that minimize complication and increase surgical safety. Now let's see what the Lasik experience looks like from one of my actual patients.
I am one day pre-op for my Lasik surgery with Dr. Cohen tomorrow.
On my way.
So what we're seeing in this part is the formation of the flap by the laser. This is the safest way to form the flap.
90%.
Now the patient is being moved to the second laser that does the prescription treatment. And as you can see, the prescription treatment is very short, it's about 11 seconds. And now I'm just replacing the flap and making sure that it's aligned perfectly with its base. And we are done. Hello. How are you?
So you just had the surgery done. How was it?
It was good. It was quick, not nerve-wracking at all.
Did you have any pain during the procedure?
Not at all.
Your vision is 20/20 in both eyes.
Vision's great. I'm 20/20.